Are you one of those people whose jaw is always tight at the end of the day? Or maybe you catch yourself clenching, you grind your teeth at night? Or you wake up with headaches and neck pain? Let's give your body a different message, because jaw tension isn't just stress. And it's not something you can fix by forcing it to relax, is it? Hasn't worked. Very often, most often, it's protection. In this video, I want to walk you through a simple 5-minute reset that you can follow along with. Something you can come back to anytime your jaw, neck, or even head just starts to feel tight. No forcing, no aggressive stretching, just small inputs that help your delicate nervous system feel safe enough to let go. I'm Dr. Melanie Carlone, physical therapist, somatic practitioner, lifelong learner, and someone deeply interested in how the body organizes around stress, safety, and protection. So welcome back. Today we're focusing on jaw tension, but not as a local problem. We're going to look at it as part of a whole body pattern, because if the jaw is holding, the question becomes, what am I trying to protect? The jaw is one of the most responsive areas of the body when it comes to stress. When something feels uncertain or overwhelming or just fast-paced more than what you can deal with, the body often organizes this area into clenching, bracing, holding on, and that's happened since childhood. And it can show up as like feeling even tight in your teeth, tension at the temples, headaches, neck stiffness. This whole area just kind of feels yoked. And many people try to fix it by saying, just relax, come on, can't you relax? But if the jaw is protecting you, why is it going to let go just because you ask it to? That holding pattern is primitive. It is the primitive brain, and it's deeper than your conscious mind is just going to turn off. So let's talk to it in the language it understands. The jaw doesn't work alone. It's connected directly to the neck, the throat, all the way down to the rib cage, your breath. And so when the jaw tightens, it often pulls the whole system into tightening with it. Your breath gets shallow. Your shoulders tend to lift up. Your neck gets stiff. And the more that system feels like it has to be on alert, the more the jaw stays engaged. So if the jaw is part of your full body pattern, what can help the whole system start to soften? It may not be what you think. So before we go into a reset, just notice, take time to notice, is your jaw tense right now? Are your teeth touching, or are they slightly apart? Is your tongue on the floor of your mouth, or is it behind your top teeth? Is there a little bit of space in your mouth, or is it pulling in? Just stopping to notice that starts to shift the problem. And if you're feeling this problem, you are not alone. So many people have jaw tension, especially now. So drop a quick comment. Let me know. Does your jaw tend to hold? Is it more in the day or the night? Let's do this together. All right, do this seated. Let your body be supported. First, orient. Let your eyes slowly move around the room. No rush. Let your eyes move and your head follow. And as you're doing this, just notice your breath. Let there be an awareness of the light around you, the definition of colors, space. And your head follows your eyes very gently and slowly. This helps you to shift out of a narrow, tight space in the nervous system. And the system, with your eyes orient like this, starts to feel safer, more noticing and aware. And what do you think happens to your jaw? Now, as you're doing this, pause and start to move the breath to the low back. Keep gently looking around and inhale into the low back. Feel your low back ribs expand out into the sides. And let your exhale lengthen. This is a really important, soft way that you can move the nervous system into a quieter mode when you breathe into the low back. It's pretty profound. Okay? Low back rib breathing, orienting, moving your head with your eyes, and lengthening your exhale. Now just notice your jaw now again. Pause for a moment, close your eyes, and and just notice. And that noticing becomes a profound effect in the body. Is your jaw a little softer now? A little quieter? Very likely you're feeling, just by moving the nervous system this way and softening the sympathetic nervous system, everything gets easier. Your jaw, as I said, connected to your neck, your throat, your rib cage, and your breath. So when you speak to it on that level, it takes an entirely new perspective on what you're asking it to do. If you're forward oriented outside of it, it doesn't think that you're paying attention at all, and it just tenses. So that's the first thing to remember. Orientation, breath into the low back, and very softly allowing the out breath to be long. All right, let's try another really powerful sympathetic nervous system reset. The alert part of the nervous system coming into the quiet of the parasympathetic. Taking a breath into the low back, I want you to exhale with the sound of VOO, V-O-O. Very soft sound. Breathing in. VOO. And as you're doing it, feel the vibration. Let it vibrate your throat all the way into your chest, even your belly. Let that just go 3 or 4 times, inhaling and exhaling. Voo. You literally are stimulating the vagus nerve that lies here in the throat, right through the jaw. Vibrational frequency. It's all frequency. And the nervous system has that sense of peace, and it starts to settle. And when that happens, what happens to the tension that you were holding? Now, let's try one more simple thing. Slowly lift your shoulders towards your ears, hold gently, and exhale with a VOO. VOO. Let them melt down. VOO. And again. Breathing in the low back, lifting, and exhale with VOO. Let the release be slow. Let sound and breath follow it. And so often the jaw and shoulder will mirror each other. And if the shoulders soften, what else might follow? Let's do one more with your neck specifically. I want you to imagine your nose has a pencil on it and draw a very small circle in the air, tiny. And then go the other direction. And just notice, what's that like? You probably, like many of us, if you're sitting up, as I always say, ear over shoulder over hip, and you do your circle, that when you go downwards, it's more difficult. So try to make the circle smooth. Stay curious. Don't fix it. And now I want you to do a figure 8 sideways. Just notice. Keep breathing in the low back ribs. Lengthen your exhale, long and slow. This helps restore small, safe movement through the neck and the head. And when movement feels safe, what happens to that need to brace? And just pause now. Pause and notice. Notice your jaw. Are your teeth touching or are they open? Is there some more space? Does your breath feel different? Small changes really matter here. That's your body responding. And the key is consistency, not intensity. This reset doesn't work because you force something. We widened our perception. We softened the jaw through vibration. We reduced shoulder tension. And we reintroduced gentle movement into the jaw, neck, and shoulders. And each of those sends a signal. Basically, you're safe enough to let go. And when the nervous system, the primitive part of the brain, believes that, the protector pattern can start to ease. So if this worked even a little, what would happen if you repeated it throughout the day? And that's what building a daily habit can look like. And you don't have to do it perfectly or all at once, but even one little piece helps. Just the VU breath, or just orienting with the eyes and the head. Just lifting the shoulders, because small inputs, when they're repeated often, are most likely to stick. And the jaw doesn't need to be forced to relax. It needs to feel safe enough to stop protecting. So try building what I call a tiny habit. Match this practice to something you already do regularly. And that way it doesn't take extra time, and you'll think of it. You can make notes or whatever. You'll actually get it done. I do it. I go to the bathroom. I do a lot in there. And it's a great way to reset an open space within myself. It's like a reset, a rest. Go into the bathroom, sit down, reminded, oh, yeah. Do some of the movements, jaw, takes it down. Really helpful. I'm on Zoom meetings a lot in the day. It's powerful. So if your jaw has been holding for you, it's not a flaw. It's a strategy to help. Your body's ever always trying to help. And don't fight that strategy. Work with it gently, consistently, and bring curiosity instead of pressure. It changes everything. And over time, that's what changes the pattern. So if you followed along to here, let me know what shifted, even if it was subtle, because those tiny changes are where the real work begins. And if you want more simple resets like this that you can use in real time, make sure to like this video and subscribe. That's the thing I ask you to do. Next time, we're going to explore something a lot of people are dealing with, but don't always connect to their nervous systems. And that's why your belly feels tight all the time, and how to finally let it soften. So until then, move with kindness, breathe with awareness, and trust that body of yours. It's always, ever trying to help. Take care, you guys. See you later.